You ready to go?
I'm just printing it off now. Don't press print, wait till it says.
Oh yeah, sorry.
Just rip that quickly. That's an idea. Two. That's better. Go for it.
Hello, I'm Bridget, CCP.
Hey Bridget,
How
how
are
you
you?
going? I'm Cam. So I got called to a 42-year-old gentleman here, central chest pain. I've just sort of got here myself. I'm been here long at all. Done a 12 lead, looks like it's inferior, and I can't get a blood pressure, mate.
Sure.
I
That's
feel
quite
great.
slow, isn't it?
Yeah.
Yeah. Okay. Would you start getting IV access for me, please?
Yep.
I'll give you that, and you look for a cannula.
Oh, I don't feel good, hey.
Hello.
Hey.
I'll take your hand. What's your name?
Aaron.
Aaron. Nice to meet you, Aaron. I'm Bridget. How are you feeling?
Oh, I don't feel good. There's pain in my chest and struggling to keep focus.
Okay. How long have you had the pain for?
Oh, about 45 minutes now.
Okay. You look very pale and you're sweating,
Yeah.
and I'm not getting a strong radial pulse.
Nah,
You know,
my
put
fingers
that
feel.
down in your finger. So what happened? When did you get this pain?
I was just watching TV and about, I don't know, under an hour ago now. And it came on and got worse and worse and worse. And about 20 minutes ago I got really sweaty and dizzy and having trouble focusing. And now the pain is just, really bad. I don't feel well at all.
Super, thank you. Has Cam given you any aspirin yet?
No, he just started me all this
No
stuff
worries.
on me.
I'm going to give you an aspirin to take. Have you ever taken aspirin before?
Oh, for migraines and stuff, yeah.
You're not allergic to it. You don't have any bleeding problems or tummy ulcers.
No, not that I'm aware of. I had a hernia about 5 years ago repaired.
No worries, that's fine. So I'll give you one aspirin to take. I'll get you to chew that, and I'll give you a little bit of water.
What do you want to do first? IV access.
Just so you can take it on.
So you've had that pain now for 45 minutes?
I think so, yeah.
have you
About
ever-
45.
Have you ever had that kind of pain before?
Oh, not like this. Probably last week or so I've had a couple of little bits of pain. The last about 10 minutes have gone away, but this is just not going away. It's getting worse. And when I started to get real sweaty, I got scared. What do you
Sure.
guys?
So at the moment your heart is beating very slowly, and it
Oh,
looks like it's struggling. So we're going to give you a few medications. We're going to pop a cannula in your hand. Are you looking for a taste now?
yeah.
I've got some here.
So, well, can you do something about this pain?
Yeah, we're going to get on top of the pain as quickly as we can. First thing we're going to do is try and speed up your heart a little bit, just
I'm a
to
bit dizzy.
because you're very poorly perfused.
What does that mean?
It means your blood circulation to your body isn't very good at the moment, and your heart is beating very slowly. So we're going to try and deal with that. You don't have allergies to any other medications that you're aware of?
What did I have my hernia? Oh, sorry, maybe.
Thanks, man. Would you start by fluid, please?
Morphine. Some morphine, maybe to go a bit loopy.
Loopy in what way?
I was out of my mind, vomiting heaps, and
Okay,
I just wasn't myself, and they said I shouldn't have it again.
Sure, we won't give you any morphine today.
Oh, this pain.
So again, sodium chloride,
It's
intake April 18.
18, and I'll show you this. Atropine 1200 mics in 1 ml, September 16.
Yep.
I don't feel good.
So the dose of atropine I'm going to give is 600 mics, which is half of this volume,
Just some water hanging up, mate.
Whatever, mate, whatever you do.
and run that in.
Oh, I don't feel good at all.
At the same time, I'm just going to pop this in here. So I'm giving you 600 mics of atropine, IV, at 159, that's half a ml. Would you pop the pads on if you don't mind?
Yep.
Thanks, just in case. I'm going to keep the rest of this afternoon in 5 minutes time. So hopefully now that will make you feel, or in 2 minutes time, hopefully that's going to make you feel a little bit better. It looks to us like you're having a heart attack.
Oh, I knew it.
Unfortunately.
You happy if I just move those couple of leads?
Yeah, sure, yeah.
I'm just going to put a sticky, sorry mate.
Yeah, what do you do? Should I call my wife?
In a few minutes. Is she here in the house?
No, she's away.
Okay, yeah, I don't really stick on my camera in your torture room. We'll get you to call her in a few minutes. First of all, we're going to we're going to look at getting some treatment for you here because we're so far from the hospital. So to do that, I need to go through an important checklist and ask you a few questions. So you're going to be able to concentrate
I
on
do
that.
feel a little bit better actually.
Yeah. Okay. So
now.
60. Okay, I'll hold off on the second dose of atropine in that case.
Oh yeah, head feels a bit clearer.
And the fluids are running. Oh, can I hang that off?
There's only 2 of these.
So I need to ask you some important questions.
Okay.
It just takes a little while.
Oh, that feels better for that pain.
Super. Thank you. So, you're 42, isn't that right?
Yep.
And you live here independently at home?
Yeah, it's home on the day off work.
Okay. Why were you off work today?
I just lost the day off, shift working.
At what age are you, Aaron? 42?
Yeah.
And what weight are you, do you think?
78.
Kgs.
Oh, is this pain? Have we got anything with the pain?
Yes, would you drop some fentanyl, please? Yeah, we're going to hold off on the atropine just because of the blood pressure and the heart rate. And I'll just run another blood pressure off. That's come up a little bit.
You get that tape again, please?
So we're more than 60 minutes from the hospital.
Thanks
Thanks, Pam.
Or December's right.
Your GCS 50, you've had your pain for less than 6 hours. Your ECG is consistent with the inferior Stemi with the normal, narrow, QRS complex, no bone branch.
Is that for is that pain? The pain?
This is for the pain, mate.
Sorry, Mark, was I meant to say anything?
Sorry, I'm talking to myself so far. So,
Oh, I do feel a little bit better with this pain.
so important questions now. Are you allergic to anything?
I've been told not to have morphine again.
Morphine, yeah. Tenecteplase, enoxaparin, clopidogrel, none of them sound
I don't
familiar to
know
you?
what they are.
Okay. And about your medical history, do you have any blood clotting problems or blood cell problems or anything like that?
Not
that
that
you
I've
know?
ever been told, no.
Okay. Have you got TB?
What's that?
TB, tuberculosis, like an ongoing infection in your lungs or in your bones
No,
or
I've
anything
never
like that?
been told that.
No, okay, no worries, you'd know if you did. Do you have any problems in your brain, like tumours or cancer in your brain?
No,
Or
no.
any vein problems in your brain?
Vein? No, I don't think so, no. No one's ever said.
And you've never had a bleed in your brain?
No, no,
Did you ever have a stroke
no,
or a mini stroke?
no, no.
Did you ever have any accidents that you badly injured your head or your brain?
No, no.
No, and you haven't had any accidents or falls, trauma in the last 3 months?
No, no, no.
Do you want another blood pressure or because
I've just run one there, so that's a very current one. Yeah.
125, 190?
That's
Would
accurate.
you give them 25?
That's accurate.
Yep, so 25.
25 marks, please. Yeah.
So this is for the pain?
Oh, please.
Have you had any surgery, Aaron, recently? You had the hernia?
Just the hernia, that was about
Nothing, so
4 or
not
5
even-
years ago now.
Not even on your eyes? No
Eyes.
operations on your eyes?
No,
recently?
no, the doctor got good eyes.
Good. And do you have any bleeding problems? Do you bleed when you open your bowels or when you cough or you vomit or pass urine? Do you ever see blood?
No, my urine's been a bit bright of late, but
But not red or dark?
no, no.
And you don't have any bleeding problems, you said to me earlier, like hemophilia or anything like that?
No, I don't know what that is.
You might feel a funny sensation, mate. Just giving you something for that pain.
Yeah.
What about medication you're taking at the moment?
Uh,
What medications are you taking at the moment?
None at the moment.
Good. You told me you don't have any cancer. Do you have any big liver, kidney diseases?
No, not that I know of. No one's ever said anything.
No. Okay. So that's all good. Everything there is positive. So I need you to understand this. Are you listening? Yeah. This is
Yeah.
consent for us to treat you for the heart attack.
Okay.
So I'm going to read this out to you. It's likely that you're suffering from a heart attack. With your consent, we'd like to give you the following medications to restore the blood flow back through your heart. One drug to dissolve the clot called tenecteplase, and some drugs to reduce the clot formation, enoxaparin and clopidogrel. The sooner you receive these medications, the lower the risk from your heart attack. So we want to start as soon as possible. The treatment with these medications early will improve your chances of survival by 20 to 25%.
Survival.
Yeah, so this is serious, a heart attack is quite serious, but we're able to treat you here now and you'll start getting better. Mm-hmm.
I think I should call my wife.
Yeah. Just let me finish here and then straight away after that you can call her. Will you carry on with the fentanyl every 5 minutes? Thanks. And your heart rate stayed at 60?
At 65 minutes.
Sure, yeah.
Do you want to go?
No, not at the moment. I'm going to hold off on that. Thanks, yeah. So this treatment improves your chance of survival by 20 to 25%, but it can cause serious side effects in a small number of people, and that's why we're discussing it. So the biggest risk is that you could have a life-threatening stroke, and that happens to about 1 in 100 of every people treated, every person treated. Or you could have about 1 in 4 have some significant bleeding that needs treatment. And a small number of people have allergic reactions, but we're able to manage allergic reactions. No, it's very serious. It's a serious medication, but you're also having a big heart attack. So what
would you do?
I would take the medication now because it's supported by what the hospital would do if they were in the situation that they treat you right now too. Yeah, and the guidelines for.
Still got that pain arrow?
Oh yeah, that hasn't helped at all.
Another 25?
Yes, please. Yeah. So this is a box here. I need you to sign. Thanks. And do you have your phone? Do you want to phone your wife?
Yes, please.
Excellent. Thanks very much. So I'm going to start off with the enoxaparin IV. I'm going to give you 30 milligrams.
Whatever you need to do.
Sure, yeah. And would you organise the clopidogrel for me, please?
Yep.
Yeah. So enoxaparin is 0.3 mils, 30 milligrams. Push that IV. I don't have the right syringe, so I just get rid of 1 mil, so there's 0.3. 0.1 of a mil, so there's 0.3 of a mil left in a 1 mil syringe.
Okay.
So it was 40 and I've gotten rid of 10 and now there's 30 left. Look at the time, so 15 minutes after that we're going to give the subcut dose. Yep, that's the clopidogrel.
Have a bite.
Sure, yeah.
And what subcut dose you going to
Your weight again is 78, so I'm going to give you 80 milligrams, which is 0.8 of a mil, so I've got 15 minutes after that dose. I'm going to give you the tenecteplase next, so I need to mix that, draw it up. You are 70 to 80 milligrams, so I'm going to give you 8 mils, which is 40 milligrams of the tenecteplase. We've done the checklist, I've mixed it, drawn it up, and I've discarded the 2. I'm not going to give, so I'm going to give you the other 8 now. Okay, so push that. One time. And then we're going to give 300 milligrams clopidogrel. So there's 75 milligram tablets, so we're going to take 4
of them?
Yep, please.
More tablets.
Yeah, more tablets until you're out.
Just swallow them, don't chew them up.
Taste it.
We'll give you a little drink of water.
Sure, yeah.
So that's 4 tablets?
Yeah, so that's all in. Will you get the stretcher ready? We're
Absolutely.
going to start getting ready to move. And I'm going to do another 12 lead ECG. In the meantime,
So it's 2 minutes since that last
excellent.
fentanyl.
Fentanyl, yeah, okay, I'm going to carry on with that. So, another blood pressure.
Any more for the pain?
Yeah, in 2 minutes' time we'll be ready for more pain relief.
Can you give me more?
We can. Yeah, is it still, pain still very bad? Yeah, I'm hoping it will start to improve now that you've had the medications to cut down the clot in your heart, and that should start to make you feel better. So overall, I'm going to do a quick reassessment now. Your GCS 15, your airway is patent, your breathing still looks nice and normal, your perfusion, I gather, has improved, your blood pressure has come up, you look less grey, less diaphoretic. ECG, your heart rate is faster now, your blood pressure is normal. I'm doing another printout immediately post fibrinolysis, and we'll do it again in a few minutes. You are still in bad pain. We're going to continue managing your pain, and we are going to give you that other enoxaparin in a couple of minutes. And I'm going to contact the hospital once we get going and let them know you're coming in.
Code 1 or code 2?
This stage we're going code 2. You're stable, you're post-lysis, and we have an 18-minute transport time.
Thanks. Cool. Yeah, with no questions, so we'll stop recording.
Sure. Sorry, mate, that one stuck a little bit.
Nah, you're good.
Sorry.